Forward. The training of medical students is always an ongoing discussion, necessitating changes in the curriculum every few years to keep up with progress. We've got away from the didactic teaching of yesteryear to a more focused approach on students and how they learn. Ultimately, of course, it is how they approach and speak to the patient. This skill is taught initially in clinical laboratories by learning methodologies, single patient encounters, and then onto wards, clinics, or GP surgeries, where students will practice their newly acquired skills on patients. These measures may lessen the anxiety of that first patient encounter, but the student does this in the quiet surroundings of a ward and is closely supervised. Nothing, however, lessens that overnight transformation from a student with little responsibility to being the doctor responsible for someone else's life. A huge leap into the unknown. In a Lancet editorial in 1999, Chandler said that medicine used to be simple, ineffective, and safe. Now it is complex, effective, but relatively dangerous. How very true. But, of course, this adds to the anxiety of suddenly becoming a doctor, and the dawning realization that now is the real thing that one has striven for over at least 5 to 6 years. With the development of many new therapies, devices, and drugs, a physician is now faced with an armamentarium of therapies, all of which need to be carefully considered, with their side effects, cross-reactions, and toxicity prior to prescribing, all adding to stress and anxiety. So, how does one approach this massive leap to responsibility? Will the Bleep Test help? I started reading this book thinking it would contain a long list of things that a new doctor might or should do. I was therefore taken aback when it was more about the person and the thoughts and feelings that the new doctor encountered. The incidents and events are descriptions of real-life encounters. The book tackles the first few years of being a doctor, relating real experiences, but with a background account of self-reflective thoughts that went through the author's mind. It is semi-autobiographical and therefore more authentic. For example, the author describes the multitasking, frenetic and anxious junior doctor switching between problems with lists of to-do jobs and the difficulty they had with prioritizing. I remember doing this myself when my junior doctor asked me to swap places with her as she thought consultants didn't have much to do. Despite my many years of experience as a consultant, I found that prioritizing patients' problems was the most difficult, particularly when one's to-do list was thrown out of kilter, as a crash call came in for someone with very severe chest pain.